So my topic is nurse-to-patient ratios in hospitals. How does it relate to patient safety? Well, nurses are the only healthcare staff providing a continuous presence at the patient's bedside. Therefore, they are more likely to pick up on deterioration in the patient's condition and initiate appropriate interventions to minimize the impact of adverse events for the patient. Inadequate staff reduces the amount of time a nurse can spend with the patient, which reduces the likelihood of noticing these early signs of deterioration, compromising the patient's safety. There is sufficient evidence suggesting that nurses who have high workloads are associated with a high number of adverse events resulting from easily manageable complications such as UTIs, pressure injuries, sepsis, surgical wound infections, and DVTs. An increase of one patient per nurse increases the chances of a patient dying within 30 days of admission by 7%. And how does it relate to a healthy workplace? Well, high patient-to-nurse ratios is closely linked to emotional exhaustion, job dissatisfaction, and fatigue. Nursing fatigue or burnout is common among staff with heavier workloads and describes a number of symptoms including irritability, headaches, insomnia, back pain, weight gain, depression, and high blood pressure. So why is this an issue? Well, inadequate staffing in hospitals is an issue worldwide due to the shortage of nurses and midwives who represent more than 50% of the current shortage in healthcare workers. In Australian public and private sectors, there are difficulties in recruiting and retaining experienced nurses, and it is expected that this will not improve in the near future. It is predicted that Australia's demand for nurses will significantly exceed supply, with a projected shortfall of 85,000 nurses by 2025. What is being done? Well, in Australia in 2015, Victoria became the first state to legislate minimum nurse and midwife staffing in state public hospitals with a minimum 1 to 4 on morning and evening shifts and 1 to 7 on night shifts. The legislation introduced a new rounding method to determine the number of staff. In most circumstances where the number of patients on a ward is not divisible to a whole number, when a ratio is applied, the number of nurses or midwives must be rounded up to a whole number, thus increasing the amount of staff. For example, a 30-bed medical or surgical ward with 1 nurse to 4 patient ratio requires 7.95 nurses. Instead of being rounded down, it will increase to 8. The mandated ratios have been effective in increasing the amount of staff, however has received criticism for being too costly. Nursing staff levels in New South Wales are mandated through an industrial award. The New South Wales Public Health System Nurses and Midwives Award uses the Nursing Hours per Patient Day tool to calculate nursing hours per patient day ratios, which takes into account the type of ward and the location. A rally was held at Parliament in 2018 by nurses and midwives calling for mandated patient-to-nurse ratios. The Health Minister Brad Hazzard commented that he understood the need for a different method and more nurses could be added. However, the Premier refused to make any commitments and expressed the government's hesitation as the blunt nature of ratios does not provide flexibility. And here is just a picture of where each party stands on the issue. So what is the background of the issue? Well, Australia, along with other countries, has an aging population. According to the Australian Bureau of Statistics, the number of people over the age of 65 has increased from 1 in every 7 people in 2011 to 1 in every 6 in 2016. Aging, together with the increase in chronic diseases and longer life expectancy, is creating a higher consumer demand for healthcare, and more comprehensive involvement of healthcare professionals, but particularly nurses, is needed. The workforce is also aging, with 38.6% of nurses aged over 50 or older in 2011. When these older workers retire, there will be a shortage of skilled and experienced nurses. The crisis of attraction and retention is likely to exacerbate the current nursing shortages. Why is this significant to contemporary nursing practice? Well, the National Standards for Registered Nurses provides a guideline on how nurses can provide safe, quality and professional nursing care in Australian healthcare facilities. Standard 3 is maintaining capability for practice. This means that nurses are responsible for their well-being and the well-being of others to ensure they are fit enough to practice. If nurses are experiencing issues such as burnout, fatigue and stress due to their patient load, it is their responsibility to take action and do what they can to improve their well-being. Standard 6 is providing safe and appropriate responsive quality nursing practice. This means that nurses must be able to provide care that reaches the agreed goals and outcomes that are responsive to the nursing needs of the people, and they must be able to appropriately delegate aspects of practice to enroll nurses and others, and use appropriate processes to identify and report potential and actual risk-related system issues and where practice may be below the expected standards. If nurses are working in environments that have significant issues that impact on patient safety and their well-being, such as one with inadequate staff, they must follow procedures appropriate to their facility that help to identify and manage these problems. According to the New South Wales Health, this could be verbally reporting it to a supervisor or manager, reporting through workplace hazard reporting procedures, raising the issue with health and safety representatives, or raising the issue with management through a union representative. If these actions fail, the last option is to contact the New South Wales Government Safe Work Branch. How can effective leadership resolve or mitigate the issue? Well, there are a number of different strategies and approaches leaders can implement to resolve or mitigate the issue that come with high patient-to-nurse ratios and inadequate staff levels. For example, they can ensure that nursing staff can provide the quality of care expected by allocating realistic workloads within realistic timeframes. They can encourage teamwork and collaboration within the workplace. They can encourage new nurses to find mentors to enhance skill development and lessen the chance of resignation due to factors such as stress, fatigue, and discouragement. They can empower nurses to speak up and have a voice about safety and health issues within the workplace. And they can ensure an adequate skill mix and staffing levels to deliver quality care. So what are my responsibilities as a new graduate nurse? Although the number of patients per nurse is not a decision within the hands of a nurse, nurses still have a responsibility to keep patients safe at all times. This means as a new graduate RN, I must work within my scope of practice, have the ability to delegate aspects of care to other healthcare workers such as ENs, to be open and honest when a patient is harmed by healthcare, to take responsibility for my well-being by taking action and getting support in struggling with burnout, fatigue, and stress, or other issues that may significantly impact my practice, to provide support to my colleagues and be an active part of the team. And what are my responsibilities when educating patients and families? My responsibilities are to encourage patients and families to have a voice and to speak up when practice is unsafe and compromising their well-being and safety. To provide education on self-management strategies in relation to their condition or illness to reduce the chances of readmission or prolonged stay. To encourage them to ask for help or assistance when needed, and to provide education on signs of deterioration and to tell them to inform a nurse if experiencing any of these signs. Why was my information communicated this way? Well, the aim of my presentation was to ensure that the information could be understood by people of varying ages, backgrounds, and learning styles. This meant I had to use different forms of communication, such as visual images, an audio recording of my voice, and clear written English to accommodate for a diverse audience. I also chose to use summarized dot points in my PowerPoint, so my information was easy to understand and read. I wanted to make each question a slide in order that my presentation was logical and easy for my audience to follow. Overall, I wanted to ensure that my presentation could be understood and well received by my audience, leaving them informed and educated on my chosen topic, however not overwhelmed with masses of information. Lastly, I wanted my information to be supported by recent evidence and research, which is why I put in in-text references at the bottom of each slide. This also gives my audience a chance to participate in more extensive research on the topic. How does my presentation highlight effective leadership? The decision of how many patients per nurse is not a decision entirely made by nurses in hospitals. However, nurses still have the power to help lessen the burden that comes with a heavy workload by following the strategies that I've given in my presentation. This includes things such as delegating aspects of care to healthcare workers to lessen their workload, to always work within their scope of practice to ensure they aren't taking on care they aren't able to perform, and to take responsibility for their own well-being by getting support when feeling burnt out or fatigued. Taking on a patient load is not an easy task. However, I believe that my presentation has emphasized that registered nurses must take responsibility and put strategies in place to make their work less stressful and ultimately keep patients safe and free from harm, which is the most important thing and should always be the outcome of our care. How has research and policies supported my presentation? I've used relevant and up-to-date research and policy to support my presentation. For example, I used the Registered Nurses Standards for Practice to help formulate my answer in regards to the significance of nurse-to-patient ratios to contemporary nursing practice, which are the general standards for all registered nurses across Australia as created by the Nursing and Midwifery Board. Another source I used from the Nurses and Midwives Association, which had detailed research on patient ratios in relation to patient safety in Australia and globally today. I used the research to support my answer on how patient ratios impact patient safety. I also used statistics from trusted sources such as the Australian Bureau of Statistics, Health Workforce Australia, and the Australian Institute of Health and Welfare as evidence to support the background behind the issue, which included the aging population and workforce. And here is just my reference list.